Hello everyone, it's Hannah Poulton from HLP Therapy and the Positive C-Section and the co-founder of Everything Natal. Today I'm going to be talking to you about the emotional aspects that you may feel following your surgery. Now, primarily I'm going to be focusing on that C-section and hysterectomy scars and breast scars, but actually you may feel any of these emotions after you've had surgery. So the first thing I want to talk about is before you go into surgery, that preparation. It might be that you have lots of friends around you and lots of support and people understand and listen and are there for you. And then after your surgery, you find that actually your friends don't understand as much and they think that recovery should be that 6 to 8 week window and then everything should be fine. And you find that support drift away. Well, actually, I'm here to tell you that it can be really difficult, and the friends that you think might be around you are there for a few weeks, but actually don't understand what you have been through, and that support isn't there, which is really difficult. So my advice is keep talking about it, telling people how you feel, help them to understand how you are doing. And it's okay not to be okay as well. People think on the outside, you might have returned to work, you may look the same, but inside you may feel completely different. And that's okay to feel like that too. I always say to my clients who come and see me at the HLP therapy clinics, the emotional aspects of your scarring will take so much longer than the physical aspects to recover and heal from. And there's no magic timeline, there's no 6 to 8 week window. You recover in the time frame that you feel is right for you. That could be 6 weeks, it could be 6 months, 6 years. However you need to recover, then you can recover. You'll also feel that fear after you've come out of your surgery. Where's the professional support with your scar recovery? What do you do for your scar? What do you put on it? And I'd encourage you to look at all the YouTube videos, my Instagram videos that we have for free for you to help you with your scar recovery. What to put on your scar, pat dry your scar in the early stages, look at your scar when you feel able to, keep it clean, moisturize it around that 4 week window, start scar therapy at 6 weeks. There is so much you can do. If you're not happy and think you might have an infection or an opening in your scar, please go and see your GP. With any kind of surgery, your recovery can feel super lonely. It can take time. You need to be able to rest and recover in your way. So get the support that you can in place before you go through any kind of surgery. That's especially true if you've had a C-section and of course you're recovering and looking after a baby as well. It can be really hard work. So get your support. Don't worry about the house and the cleaning. Get someone in to help you if you can, your partner, your neighbour, a best friend, a family member, somebody that you trust that can support you as you're recovering. Then, of course, it's that intimacy. After any kind of surgery, breast, C-section, hysterectomy, your body will feel different. You'll feel changed in some way, and this might be for the better, especially if you've recovered from cancer treatment and you're in that survival phase, then that is fantastic. But that intimacy with your partner might be different. There are lots of useful websites out there. The Intimacy OT is great if you want to look at her on social media, talking about that intimacy with your partner. But talk about how you're feeling, talk about how the effects of your scarring has impacted you and how changed you may feel from the inside out. In those early phases and in the weeks after in your recovery, we encourage you, nourish yourself with good food, hydration, proteins, oily fish, things that are going to help and heal and enhance your recovery. And of course, take your time. Don't compare yourself to anyone else who's had a similar surgery or C-section birth as you. Everyone is different. Every scar is different. And I've been doing this for over 20 years and I still haven't seen the same scar and the same story. Everyone is different and your journey and recovery is unique to you. So what I want to say by finishing this video is we wish you all the best in your HLP therapy, from HLP Therapy, in your recovery journey. Follow us on our social media platforms. There is a wealth of information that can support you. And we wish you all the best and you're doing a great job. Take care. Bye-bye.